Feeling limited by knee, hip, or back pain holding your back? You're not alone. I'm Dr. Tammy Penhollow, a joint specialist, a spine specialist, and today we're shining the spotlight on the often overlooked heroes of movement, the hip and pelvis abductors. These essential muscles are key to stability and overall performance. So join me as we explore how strengthening your gluteus medius and your gluteus minimus can enhance your mobility. Plus, I'll share 3 top exercises that are easy to follow and super effective. Let's jump in. First of all, what are the abductors, the abductors? We have tensor fascia lata. We also have gluteus medius and gluteus minimus. We're going to focus on the latter 2 because they are often overlooked. We're doing a lot of motion like this. We don't do a lot of lateral or side-to-side movement in our everyday. And in fact, most of us do a lot of this. Okay, we're sitting. When we're sitting and those muscles are engaged, then they are abducted. But when they are not engaged, they're not being used, we tend to roll in this way. And that weakens them. There's no firing to the muscles, and they end up becoming inactive. If that occurs, then we have issues. We can have pain all the way from the back, the hips, the knees, or even beyond, because we've talked about the kinetic chain, everything working up. But let's specifically talk about the knees right now. Specific things that can happen with the knees are if you are not strong in your hip abductors, things that take it away from the body here at the hip rotation, external, or abduction this way, moving away from the midline of the body, then we can get weakening, and the forces that translate as we walk are more likely to be down through the medial aspect of the knee. That can create pain here at the pes anserine bursa. It can create pain in the patellofemoral tract, and we can get patellofemoral tracking disorders where we're more likely to come off to that medial side and create more medial knee pain or inside knee pain. We can actually have issues with the anterior cruciate ligament and more injuries when these abductors are weakened and they're not firing like they're supposed to. That can translate up into hip pain and then wear and tear on the hips and accelerate the osteoarthritis of the hips. And what's above that, the lumbar spine. Just think again, if you're not abducted or rolling externally away and you tend to move inward, that translates forces completely up the chain and can create a sagging of the back that's worsened by weak abdominal muscles and the whole core. So I even consider the glutes as part of the core. Quick little side, the core is going to run from the back base of your skull all the way down to where you're sitting. So that's why I can include these with that, because if the hip abductors are toned and are firing the way they're supposed to, that's going to help keep your core stable. So let's talk about 3 very simple exercises that are going to assist with activating, firing, strengthening those hip abductors, the glute med and the glute mid. I'm going to start with 1. You can use something like a cinder block. You can use 2 very strong books. You can use a formal step like the aerobic step. But either way, I want you to find something that is going to elevate. The first 2 exercises are simply using this step. So whatever works for you. I'm going to stand next to it. I'm going to step up and down. Step up and down. I'm not actually bringing my second foot to the book, and see how I don't want to have the pelvis this way. I don't want to have the pelvis that way. It throws me off balance. So coming back over to this side, step up, pelvis is stable. Step up, pelvis is stable. It's working the leg that is stepping up, so the glutes. Step up. Okay, I'm going to show you again. Step up. I want to go to the other side, and you want to be balanced here. This is really good for making sure that we don't get a big tendinopathy, something where those wear and tear, we get little calcifications, we get overstretching, we start to get little fraying. We hope we don't have a tendon rupture. That is simple here. So 3 sets on each side of about 15. So this is doing the work. It's activating now. I'm really activated here. It pushes me up. So this is squeezing up right now. I could just stay like this, but that's our second exercise. So let's move into that. This is more like a pelvic dip. It's also called a pelvic hitch. So using this again, I'm going to slide it over here so we can see us. I am going to step up here. I am going to watch for the stability of my hips. Right now, they're completely stable. Working this leg, I'm going to dip my pelvis down. So this falls down, I'm contracting, this comes back up. So dipping, coming back up. I'm not bending at the knee. I am releasing here. And what is bringing this hip back up is contraction here. You should feel a kind of a burn in that upper quadrant of your glutes right in here. You can even put your hand here like this and feel that that is what's contracting. So nice and gentle. This is also working on your stability, your ability to balance on one leg. So if you don't feel, or you start to feel a burn in your quads, then just bring it back. Make sure that your pelvis is level to start and just dip. And I'm already starting to feel that burn. So that's good. We move to the other side. So similarly, the other side, coming back up, pelvis is level, drop it down. This moves it back up. Right? It's not me bending like this. This is my knee working. These are my quads here. Not that at all. So it's all in the glutes. The glutes right here are doing the work, not my quads at all. So that's number one and number two. The third one you can do on the ground. I'm going to show here because it's elevated. And it's a very common exercise. How many of you have heard of the bridge? Well, this is a single leg bridge. Now show the side that is going to be worked first. It is going to be where you plant this foot into the ground. I'll bring this leg out here. This one comes up like this. So my knees are now touching, or you're not totally like this, but touching. And you raise up, hold for the count of 3, 2, 1. Slowly bring it down. This is absolutely isolating that glute medius and glute minimus. A lot of the other exercises that you see, like the old clamshell or the lateral leg raises, can recruit other muscles. This really does not. So let me get this out of the way here. So starting to get here, raising up, holding, slow, gentle, down. That's only my glutes doing that. So up, holding, slow, gentle, down. This is what it looks like from the underside. So this one is up. You see the straight. Raise it up, hold it, hold it, hold it, hold it. Gentle back down. So these glutes are the planted leg glutes are the ones that are doing their job. So we've talked about the step up, the hip dip, and the single leg bridge. You want to look at doing probably 3 sets, 10 to 15 reps. And if you start to get bad form or failure of your form, then you want to stop and take a break, because you'd rather do this in good controlled form and not injure yourself. But doing these is going to help all the way down from the lumbar spine to the hips to the knees, and it's going to keep you doing the activities you love. Please like, subscribe, and if you have any questions, ask me below. I will answer those, and if you have any suggested topics for our next episodes, please leave those too. Thank you. Have a great day.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.